we need to understand the anatomy of a tooth and how it relates to the rest of the body. They're not just big chunks of calcified material. Teeth are a complex and integral part of the body. They have feelings. The enamel is the part of the tooth that we all know as the crown with which we eat, bite and smile. Dentine makes up the inside of the crown and the bulk of the root of the tooth. Down the centre of the root is an empty space known as the root canal. This canal opens at the end of the root, called the apex, deep in the jawbone. Through this opening enter the nerve fibres and blood vessels which bring nutrients to the tooth and take away the toxins. These contents of the canal are called the dental pulp, or in lay terms, the nerve of the tooth. Around the outside of the tooth is another slightly calcified tissue called cementum. It's very thin, and its main function is to attach the tooth to the membrane that surrounds the root, called the periodontal ligament. This ligament attaches the tooth to the bone and forms a fibrous seal to prevent infection tracking down the root. The tooth is surrounded by bone, which also has a rich blood and nerve supply and vast lymphatic drainage. Around the bone is the rest of the body. The dentine deserves closer inspection. Dentine makes up the bulk of a tooth. It's made of millions of tubes which run from the surface of the root canal to the enamel and the outer surface of the root. These dentine tubules contain tissue fluid and an extension of the cells which line the inside of the canal. There are 30 to 75,000 tubules per square millimetre of dentine. The bulk mass of any tooth is really a whole bunch of tubes packed tightly together. It's far from solid. Minute as they are, if you were to place the tubules of a single-rooted tooth end to end, you would have 3 miles of tubing. All of the dentine tubules in the root communicate directly with the surrounding tissue. In other words, they communicate directly with the whole body. Each of these tubules is wide enough to contain 8 bacteria in cross-section. Billions of bacteria can live happily in such an environment. These bacteria will penetrate to the full depth of the dentinal tubules, right out to the edge of the tooth. Through the dentine also pass the accessory canals. They contain extensions of the dental pulp, which in reality is somewhat like the taproot of a tree, with branches that reach out to the surface of the root, communicating freely with the rest of the body.